Well, I actually, until I got the explanations from your charming colleague, I didn't stop and think about the contents of the pictures. And there were several pictures that are, now that she explained it to me, there's one behind my back about the patient holding a liver. Well, this is an exact reenactment of a 2,000-year-old picture showing a Greek physician doing hepatoscopy, divining the future according to an animal's liver. This is a very beautiful picture, and thank you for taking a couple of stills for me that I'm going to use in my lectures. Then there was a couple of pictures down the road. There was a picture from China about a patient who showed his life, and he scratched his image from the picture, which has a very significant, which is very significant psychologically, like he wants to disappear. And it shows that the disease is affecting him psychologically in a terrible way. He feels like he's a pariah, he's outcast. And the other part of that picture is that he's home. He's not in the street with people anymore. This is a very touchy picture, and it made me think about the different ways physicians, that is we, perceive the disease as opposed to the patient. We tell him it is not transmitted in everyday life, and it is not transmitted by normal daily activities, etc. But he does not perceive it that way, and he spends his life in unnecessary misery. He's stigmatized, or he feels that he's stigmatized. It made me think. And then there is the picture, the pink picture of like Jesus and the heart, the liver inside. This is also, it showed me some things and facts that despite being a clinician for a few years, I haven't thought about it, and I thank the organizers of the exhibition for giving us the chance to learn and to improve. Yes, obviously, I didn't think about it that way, but yes, definitely. Yes, especially the picture from China where he scratched himself out of the photograph, especially that. But also that picture about the patient. Basically, most people. Now I'll spend some more time and look at them, and also I'll read the book. It's very important. And maybe at home I'll try to arrange for patients waiting for the appointment. I'll arrange some paper and some crayons or watercolors or felt pens for them to express what they think. Anyway, it affected me. It made me think. It did the job. It enables the clinician to see another facet, another aspect of the patient that we do not usually see. You try to be a good clinician, you follow the blood tests and the imaging, and you try to assist the patient with all the practical things, with getting the medications, getting help from social services, etc. And sometimes you don't have the time, or you don't realize how important it is to really let him open up. And the patient on his side is afraid to open up, is reluctant to open up, he doesn't want to take the clinician's time. you spend 20 minutes and he sees you going over the tests and doing a serious work and trying to help him. And then maybe he says to himself, this is not important enough for me to trouble the doctor. So it's an important contribution. And I think the idea should be shared in other medical circumstances too. For auction, well, I think it's okay. If someone wants to buy it, it's okay. It's important that it be seen as one piece. But if people want to buy it, I mean, that's natural. I don't have any special opinion for or against. It's important that it be seen as one coherent creation. But if someone wants to buy, then it's okay. And then there is a book. It's a partial representation, but it is thought-provoking. It provokes thought, at least in me.